For the cutting edge of wellness, I'm Kara Sundlin. Did you get good sleep last night? If not, you're not alone. Sleep is certainly a huge issue for so many people, whether we're a mom or a kid or anybody, really, because so many people are struggling with their sleep. So we wanted to have Naturopathic Doctor and founder of Whole Health Wellness Center in Farmington, Dr. Jennifer Stagg, on so that we could talk about sleep solutions that really work, natural solutions, because a lot of people don't want to take sleeping pills.
Right.
But first of all, let's just start with the not alone factor. I used to be, I thought, the best sleeper. I thought that would never be an issue for me. Then, you know, maybe post 45, I started having issues. So a lot of people struggle with sleep.
That's such a common time, and I was the same. Like, great sleeper for years, and then all of a sudden started having trouble. So that's like that sensitive time frame, perimenopause, which we know perimenopause can go on for like 10 plus years even. So it can hit women like definitely in their 40s. And there are a lot of different strategies to use. So when we approach things from a naturopathic perspective, we kind of like look at the whole profile and come up with a treatment plan that's more personalized.
Well, I know a lot of people are struggling, and we're going to hit all the age groups, including maybe you're struggling because your kids aren't sleeping, and we'll talk about things that are safe for little ones. We'll talk about women. If you didn't know that perimenopause and menopause was going to affect your sleep, it does. You say 50% of women are going to have insomnia?
Yeah, those are the statistics. So pretty high, you know, 1 in 2 chance you're going to have a problem with sleep at some point.
So what do we do for that age group to get better sleep?
Yeah, so I mean, certainly like hormones are changing and hormone replacement is an option. So a lot of women might go down that pathway, but some women are not necessarily really there yet also. So when you first start to have some trouble sleeping, we just first start thinking about just like sleep hygiene, like making sure your room is cold enough, dark enough, simple things like having a bedtime routine. Wearing socks to bed has actually been shown to help improve sleep quality a little bit.
Okay, so this is a thing in my house. I like to wear socks because my feet are always cold, but I don't like to really go to sleep without socks. And other people think that's so weird. So actually socks help us sleep?
Yeah,
Why?
there were a couple of studies. It just regulates temperature and body temperature in a way that helps people get to sleep faster and stay asleep longer, less waking.
Wow.
Small scale studies, but still, like, pretty cool.
So if you're going to take the supplement route, let's talk about for that age group now, for women in midlife who are struggling, what's the first line of defense? What would you add?
Yeah, I probably would go magnesium first. Like, that tends to be what we do, and I would say that's true pretty much of all ages, I guess. So magnesium is a really great nutrient for the nervous system, and when it comes to sleep, there are, and just in general, there are a lot of magnesium types or supplement types out there which are chelated. So on the bottle, you'll see magnesium something, like oxide, which is not what we really want to use here. That's the more like the cheaper version. It doesn't get absorbed really well. It's good for bowel, like if you really needed to go to the bathroom and needed some extra magnesium. But when we come to anything like related to the nervous system, we want to use a chelate that's going to like get in your system more effectively. So glycinate is what we tend to use here.
So magnesium glycinate, if we're going to try magnesium, would be the first line of defense. You want the magnesium glycinate. That helps calm us down more.
Yes, because it also, like, what's happening is it's better absorbed, but also that chelate called glycinate is glycine, and glycine is just a relaxing amino acid. So we have like more magnesium in the nervous system and some glycine as well, which is relaxing.
Okay.
Yeah.
What would be a good dose for most people to start?
Yeah, probably around 300 milligrams, I would say. For most adults, that's a pretty good dose.
Okay.
And the only thing we have to worry about with magnesium is that it can cause some bowel motility. So some people could get loose stools, diarrhea. At 300, we usually don't see a problem there. And we certainly like sometimes dose magnesium to help with constipation, which can be an issue in perimenopause and menopause. So women can take magnesium at a high enough dose that it keeps them regular and they're sleeping better.
So that, yeah,
nice
2 for 1 there,
Yeah.
2 for 1. Okay, so anything else for that midlife, and men too? I mean, obviously this is, we're talking about women because 50% are going to have problems.
Yeah.
But if you're a man who's also struggling with sleep, which can happen, magnesium can be good for you too.
Sure.
Same
Yep, I would
dosages?
have them do exact same thing. Start with the magnesium.
Give it to you you and
before
your
bed.
partner.
Yep. Yep.
And of course, if you're wondering where to get this, you can certainly get magnesium lots of places, but yours, you sell it at Whole Health at your place, which if you don't have to be a patient, you could go into Whole Health in Farmington. But otherwise, you just want to make sure you're getting a high quality supplement.
Right, like a really good manufacturer like Designs for Health or Metagenics, like they both make really good magnesium glycinate forms.
Okay, and Designs for Health happens to be a Connecticut company, so you can Google that as well. So anything else that we would be using besides magnesium? We hear a lot about melatonin. I think that's what people first go to.
Yeah, it's interesting that melatonin has become like the go-to supplement, and even for kids, like a lot of times pediatricians will recommend that first, and it's certainly a very safe supplement to use. There's a pretty large body of data on melatonin as a whole, but it works well for some people, it doesn't work so well for others. It's definitely something to try, and we will like often try a formula with magnesium in it or magnesium alone. Some people will come in and they've already told me they've used magnesium, and sometimes they're saying like it didn't work for me at all, so then we don't go down that pathway. But sometimes they've taken like a poor quality supplement and they maybe didn't really take melatonin, unfortunately. So that's something to consider there.
So that's also when you're just strolling through the big box stores or whatever, you might be getting some poor quality stuff, and then you're thinking, oh, it doesn't work for me, but those might just not have the right dosage of anything, because it's not, these aren't, supplements are not tested. So you want to do something quality. So if you're going to do melatonin, like some of these, you actually have some things that combine both magnesium, some herbs, and some melatonin,
Yeah,
right?
because there are a lot of different things that can help the nervous system. So we'll often use a combination. A lot of times when I use melatonin, I'll use a combination formula that might have a little bit of 5-HTP in it. It'll have a little bit of L-theanine, inositol. Those are all really relaxing to the nervous system. 5-HTP, we've talked about this before, you do need to be careful about it if you're taking an antidepressant of the SSRI category, because that can be like a little too much additive effect.
A little too much, because the SSRI is like helping you
Yes, working on the
your
same pathway on serotonin.
Okay, so obviously we want to limit caffeine. I'm very sensitive to caffeine, so if you haven't thought of that, I think that's an obvious one. But when do you need, if you're having trouble sleeping, and maybe you didn't before but you are now, when do we need to stop drinking caffeine?
Yeah, before noon, I would say, like kind of have that as your cutoff time. A lot of people know they're caffeine sensitive pretty early on in life, and there's genetics involved in that, but sometimes people start to get a little bit more sensitive also with age, just like women in perimenopause get sensitive to alcohol. You can get sensitive to caffeine that didn't really necessarily show up that well before. So yeah, use 12 o'clock as a cutoff time.
Okay, so not after lunch, or just have your 1 cup in the morning. All right, so we've got magnesium and melatonin, and you also start with tea, and this could be really great for moms, dads, but also for the kids. But even just something basic like chamomile tea. Yeah. But you often make sure that you're steeping it correctly, and sometimes put 2 bags in.
Right, exactly. So if you're really trying to get more of a medicinal effect out of teas that you get like in your grocery store, you really want to make sure you're steeping it long enough in hot enough water. So actually boil a kettle, and a lot of times I do double bags, so have two bags put in there if you're using like a chamomile tea, and then let it steep covered for 5 to 7 minutes. And covered keeps a lot of the what are called volatile substances contained in the cup, and those are medicinal as well. Just kind of like how we think about like essential oils. Yeah, like a little saucer on top of it. Like you could actually put the saucer on the top of it and just like really concentrate it, just how you would think about like a teapot has a cover on it, right? If you were going to steep tea like that.
Okay, so I swear by, I do the magnesium, and I have the product that has melatonin in it, so I'm kind of doing everything, and it's working. I sleep now. Yeah. But I swear by the traditional medicinals, Nighty-Night Extra. So these are other herbs you're talking about, where one of them I noticed is passion flower. It didn't seem to do anything for me. The Nighty-Night Extra, maybe it'll work for you at home, has valerian. So that's another herb that's known to help us sleep.
Yeah, exactly. Valerian is really good, and it's in one of the formulas that we also use. There's another one that I really love, especially for my menopausal women, called Myocalm Plus by Metagenics.
Myocalm.
Myocalm and Plus. There's 2 different formulas that they have.
Like MYO? MYO,
MYO,
Calm.
yeah.
And so Metagenics is a high-grade supplement company, but even though you sell it in the doctor's office, you can get it without a prescription.
Yes, you can get it, not like at CVS or anything, but like online.
Yeah.
And then, so that one does contain a little bit of calcium and magnesium, but it also has some valerian in there and hops and some passion flower. And valerian for most people will work. There's this tiny, tiny subset, maybe 1%, and I have yet to see it. I just learned about it when I was doing my training, that can have an opposite effect to valerian, where it can keep them up at night. So if you drink one of these teas that has valerian and you're like, okay, that didn't work for me, you're that like rare
You're that
case.
very rare person. Well, it's like when you're at the pediatrician and they say sometimes it's okay to give your kids Benadryl, but be careful because for some kids it doesn't make them tired, it makes them awake.
Yeah.
So I guess we have to watch it.
Exactly.
So there's a lot online about also our cortisol and our stress level. So we can't really talk about sleep without the fact that you also say managing stress throughout the day is going to have an impact on how we sleep at night.
Yeah, for sure. So that's where we think about when we're talking about like personalizing a treatment to a patient. We really want to look at the whole picture and look at like what medical conditions might be present that could be contributing to a sleep problem, whether it's just like a primary sleep problem or is it part of something like depression, anxiety, poor stress management, chronic pain, restless legs. Like these are all conditions that could really be contributing to keeping a patient up at night, where I might not give them like melatonin. If it's someone that's dealing with chronic pain, I'm going to treat their chronic pain because that's what's keeping them from sleeping.
Okay. And then you have something called cortisol manager, but cortisol is that stress hormone. So sometimes our cortisol's elevated at night, and that means, okay, you're not going to sleep.
Right, yeah, so it can spike, and you can actually measure this where you can do a morning cortisol, you can do 4 points throughout the day, you can do an evening cortisol. And you see that cortisol coming up in the evening, that can cause you to basically like wake up. Sometimes we also see that with poor blood sugar regulation, where people are waking up during the night, and it's because they're basically getting a spike in cortisol overnight because their blood sugar dropped low from these like highs and lows of poor blood sugar regulation. So you also need to look at dietary patterns throughout the day to keep blood sugar regulated if you're trying to regulate cortisol, if that's part of the picture.
Well, it's funny because I mentioned that to you, that I was sleeping much better, but that sometimes when I'm trying to do the fasting, right, and stop eating earlier in the evening, I would wake up and I would realize the only thing that made me go back to sleep is if I went and I made like a little piece of, toast with peanut butter or something. And you said some of us, and maybe that's me, it does seem to help, is a light snack close to bedtime. You don't want to eat a big meal, but a light snack might actually keep you asleep longer if you're waking up feeling like, gosh, I'm hungry or something.
Right, for sure. And then usually we do like to combine something like a nut butter and like a little bit of carbohydrate. So that could be like a little bit of like cracker or something like whole grain or toast, or like a piece of fruit, like half an apple and some nut butter or seed butter if you're allergic to nuts. And that can really help with like sleep quality too.
Okay.
Yeah.
So having that before you go to bed rather than waking up and going, oh, I'm hungry. But that might be because your blood sugar went low and your body thought it was in trouble, so it woke you up.
Yep, exactly.
Okay.
Yep.
All right. So that gets complicated. If you're noticing that you're trying to do this fasting thing and it's really messing with your sleep, you might need a little bit of that.
Yeah. And then you're just working on diet also, where you're making sure you're getting enough protein throughout the day and just making sure those blood sugar levels are getting regulated to the point that maybe you wouldn't need that snack before bed.
Okay.
But of course, if you're not sleeping, that's a big problem. Anytime someone's not sleeping, even if they're coming into me about like poor, issues with weight management, I want to make sure they're sleeping, because if you're not sleeping well, that's going to like mess up your metabolism.
Okay, so managing stress with meditation and mindfulness. Not everyone has a practice, but even if you're reading before you go to bed, something not too interesting.
Yes,
not a page turner. But it's funny, I just interviewed Nora O'Donnell about this. She said she doesn't really have a mindfulness practice per se, but she really likes to get in bed and read maybe 5 pages, and then she's usually falls asleep.
Yeah.
So slowing our brain down with something like an actual book that's maybe not so exciting can really help too.
Yeah, for sure. Just like establishing, some of it is just like habits and kind of cues to your nervous system that we're like getting into sleep time. But yeah, you're right. Like it needs to be something that's not too interesting, that you're really engaged. You don't want to do that right before bed.
Yes. Maybe read a nice study online about how they studied sleep. Okay.
Yeah, something pretty boring.
And also even that stress. I mean, insomnia begets insomnia because you're worried, like, I didn't sleep last night and I know it gets so stressful, I'm not going to sleep again tonight.
Yeah.
So what do we do? What's a trick for that if you just worry, like, I'm not sleeping, and then you get stressed about not sleeping?
Yeah, and you see this is like certainly common in adults, but especially in kids and teenagers. You get basically this sleep anxiety where the evening, like after dinner, it starts like picking up. You're fine throughout the day and you start like freaking out. Your nervous system starts freaking out about like, oh my God, I'm not gonna be able to sleep tonight. So you really want to be careful about the messages that you're like saying verbally. You don't want to like label yourself as having difficulty sleeping, I'm a bad sleeper. Like even though that's difficult, you really just want to have a lot of more positive language about it and not like label yourself.
Yeah.
So it's a tricky one to do. Sometimes affirmations help, even if you don't believe them.
Well, the affirmation,
Right?
as we know from Dr. Laura Saunders, who's on this show a lot, is it's the intention. It's not always when you say, I am peaceful. You may not be peaceful, but that's your intention.
Right.
So let's talk about that. I think I found, I like the Chopra app, but even on YouTube, if you just put in sleep meditation, lots of them come up. So, so doing something kind of the same every night will start to prime your brain to relax.
Exactly. So, right, and that's another tool that people can use. So when we're talking about stress management, mindfulness, meditation, there's great apps like the Calm app, Headspace, where you can do these sleep meditations or even like sleep stories. Like I've even had this with like when my kids were younger teens, listening to a sleep story, which is just like just kind of like a voice that like sounds peaceful, reading this like book to you. That can be really helpful for some people.
Okay, so let's move on to teenagers now, because they're having a big problem with sleep, and I know the phones is a big deal. So we got to control the phones.
Right.
You have 3 kids yourself. So are they all teenagers now?
Almost.
12. Okay.
Getting close.
Okay. But I know one in high school, one in college, and then you have your 12-year-old. So, that's a struggle to get them off their phones. But beyond that, you're seeing teens have a lot of problems with sleep.
Yeah, there's just like, for like when I was that age, I did not deal with the level of stress these kids have, especially in high school, beyond just the phones, just the level of expectation that is put on them with respect to college, I would say, especially. And it's very overwhelming, and these kids are just like, a lot of it is self-induced. Like it's not even necessarily coming from the parents, right? And then they're staying up late to study, and that's messing up their whole sleep routine. And these kids need like a lot more sleep than they're getting, and that all sort of spirals and can fall apart. But yeah, structured phone time, like allowing them to have their phone as like an older teenager, but not like close to bedtime. Definitely need to have that cutoff.
Yeah.
And it's hard.
It is hard. I have the I use the screen time that Apple lets you use.
Yeah.
And I can't say that my older one hasn't figured it out sometimes. I mean, she's 17 now. But they also really have recognized now that they need sleep. They want this sleep or they're not going to do well.
Yeah.
So I think that's part of it. I mean, sometimes yes, we're probably dropping things here, but sometimes if you haven't done that, like pulled the phone out of their room at an earlier age, if we made mistakes along the way or whatever, using the apps to shut it down might be less than because they get very anxious of it not being in the room if they're used to it, like, oh, it's my alarm clock, I won't wake up without it. Or that kind of thing. So but really just trying to educate them, because they're going to leave your house someday and say, you need this, not sleeping.
Right, like kind of put it on them and educate them about like, and they know, like these guys are watching like TikTok and on social media, they're watching things about sleep, especially if they're noticing that they're having some difficulty with sleep. They're going to start seeing a lot of that stuff in their feed because they look at it. But they recognize the issues with phones related to sleep. So like giving them that independence to make good decisions around it and cut off that phone time for older teens is important.
What about supplements that are safe for kids? Nicole Malapa and I were talking about this because her son is 2, and it's the baby's actually sleeping better than the 2-year-old, and he gets, they're doing some behavior modification or really encouraging it.
Yeah.
But do some children just not sleep as well, and could they use a little help, and what can we do?
Yeah, for sure. Yes, I think some of it is just the nature of that, some children, right? And you're doing everything right. You've done all the sort of behavioral modifications and everything. And then that's where we think about using some supports that are, nutritional supplements, or a tea, like we talked about. Chamomile tea can be a really good option for children. That's a really nice herb for children, and it works really well. You usually don't have to use really strong stuff for little kids. They're just their nature. It's easy to treat them, and you don't need really, certainly they're little, so you don't need high doses of anything.
How would you give a kid chamomile tea?
Yeah, so I would I would steep it just like we talked about it, and then just have them only have to drink half a cup of it. And you can put some honey in it, right? That's totally fine.
What
and
if they're
cool it
really
down
a
certainly
baby?
enough.
Do you give a bottle or no?
No,
not under 1.
Yeah, I
then.
Probably wouldn't do it at that age. I mean, it's chamomile is safe, so a registered herbalist would be using chamomile tea in infants for sure. But usually you can kind of figure it out. Some homeopathic remedies sometimes we use with little drops can be really great for a baby's constitution. But yeah, you technically could use a little bit of cooled chamomile tea.
I know the Humphreys little, their homeopathic strips they put on the tongue.
Yeah.
And I used to use those with my kids if you can find them, but they used to sell them at just the drugstore, but maybe you have to get them online. But I don't know why they worked. It's just they'd be fussing, or they're teething, whatever, and you give them that little thing, and it had chamomile and beet juice, I think.
Yeah.
And just drop it on their tongue, and I swear, 5 minutes later they were settling.
So it's similar. Highlands makes a teething remedy that's a homeopathic remedy, and they are designed for infants where they dissolve really rapidly.
Yes.
Yeah. So there are some formulations like that, and I do like to use those, and that's what I use mostly with my kids when they were infants, was more sort of homeopathic remedies. I don't have any of these here today, but over 1, then I would be thinking more along the lines of potentially using even a little bit of magnesium in a powdered form.
In a powdered
dissolved.
form. So here's a powder. You can find magnesium in a powder. If you went to Whole Foods, could you find it there? If you're not gonna, or what would you ask for people? I've seen the Calm
there's
brand.
Calm that's designed and
kids.
marketed for kids,
Is
and
that
it's
okay?
good. Yeah, you can use that. That is mag citrate, so it's not the glycinate, but I still see it working really well for kids for sleep. So it's totally fine to use that. If you're finding it's not working well enough, you could try getting a glycinate sort of formula like this one.
Okay, and so the other thing that I want to talk about is we're going to do another show just on supplements that can really help with anxiety for those who either don't want to take medication or it's not working for them. But these are lavender pills. And I've heard people have this specific one.
Yep.
They might have different ones. This is by Integrate Therapeutics Lavella. And these are clinically studied, and you said people really like these because if your issue is that you can't turn your mind off and you have a lot of anxiety, worry, you might need to treat that.
For sure, yeah. So one of the signs of anxiety, part of the clinical symptom profile, can be insomnia, difficulty falling asleep, difficulty staying asleep, and taking lavender, and it doesn't have to be before bed, but this particular type of lavender is a very strong lavender oil extract that has been clinically studied in Germany and compared to SSRIs, that class of medications that's used to improve serotonin levels in the nervous system, and it worked just as well as all those SSRIs without any risk of side effects and no dependency. If you missed a day, you wouldn't feel kind of off you would if you miss a day on an SSRI. And it's just a really nice supplement that is effective and very safe. And I found if a patient does have generalized anxiety and they start taking lavender, we tend to see better sleep profiles over time.
Okay.
So I really
might take a
love
little bit
that
of time.
product. Yeah.
And is this okay for, like I said, we'll do another show on anxiety, but these Lavellas, can you get these online by Integrative Therapeutics? And is it safe for teenagers too?
Yep, so I'll treat my teenagers with Lavella as well, and I've seen good results in that age group.
Okay.
Yep.
And not so much too much younger though.
Yeah, I wouldn't necessarily. I would use other things basically.
First.
It's probably safe, but we usually use other things first.
Okay.
Yeah.
I'm just curious because that's your brand, right? Elk Nutrition. It says lights out. What's
Yes.
in lights out? That sounds really good.
So this is one of those combination products where instead of like just trying individual ingredients and having a bunch of different bottles, this product does have some melatonin. It has some L-theanine in there.
Yep.
So L-theanine is this relaxing ingredient that comes from black tea, very safe to use. It also has a little bit of 5-HTP, just like we talked about. You need to be careful if you're on an SSRI, and it has inositol in there. So this is one, like, patients get really good results with this one, especially like my perimenopausal, menopausal women. I really like this formula, again, as long as they're not on an SSRI.
That's at Whole Health.
Yeah.
And is that on, can you buy that on your website?
Yes, so yeah, you can get that through our website.
WholeHealthWellness.com. WholeHealthLLC.com. And if you want, obviously you guys do treat people. You have a whole practice of naturopathic doctors.
Yep.
So you could call Whole Health Wellness, ask for an appointment if you want to do a whole workup. But these are just things like as we run out of our last little bit of time here, what you want to do tonight. Let's say you're a mom and you're like, I just need to sleep.
Yeah.
And I'm going to go to the store right now. What would be the first? You would get some magnesium.
Yeah.
And then maybe some melatonin too?
Yeah, probably.
Or just the magnesium at first?
I would do the magnesium at first just to see, like, do that layer and see how that works for you. Do that for a few days. After a couple of days, you'll know how magnesium is working for you. Then if you want to add on something like melatonin, again, you're going to know within a couple of days. That stuff is not going to take like weeks in your system to see if it helps. We didn't talk much about CBD, but that's another.
Oh, CBD, and then here's one that you like, Ananda Professional.
Yep. So this is distributed by Biotics Research, which is another great company. And CBD can be really helpful for patients too. You just have to try these things. It's really, a lot of it is trial and error, unfortunately.
I have seen CBD help me fall asleep, but as you said, some patients,
it doesn't do anything. Right.
So it is a little bit of trial and error, but at least there are things to do, because I know some people don't want to take, a heavy sedative that makes them feel groggy. The nice thing about magnesium or melatonin is I feel fine the next day when I have to do this all day.
Yeah, exactly. So you're not going to have those like drowsy, sort of like sluggish effects the next day, which is not, you're trying to get a good night of sleep, so you want to function well the next day.
You want to function well, absolutely. Okay. So in our final minute, we want magnesium. About 300 milligrams would be a good starting point for most adults.
Yep.
And for kids, you could try the Calm powder. Just follow the dosage on it.
And it will be like, it's like laid out for like your age group of what would be appropriate dosing.
And you'll find that at the health food stores.
Yeah, or
like
Whole Foods. Yeah.
Whole Foods.
Yeah,
okay, and Whole Foods.
Easily. Yeah.
After that, you do melatonin, and I see a lot of times the dosage is starting around 3 or 5. What would you start at?
I would probably do more along the lines of 3 milligrams, and then there's also a time release melatonin that Designs for Health makes, and if you're waking up throughout the night, I like to use time released because it will often like keep you asleep longer.
Okay.
Yeah.
So put your socks on, maybe have a little piece of fruit with some nut butter, and get your magnesium in your tea. Listen, it's not always easy to fall asleep these days, but thank you so much.
Thanks for having me.
Thanks for being here for CURES. You can follow me at Kara Sunland, Dr. Stagg at Dr. Stagg. Have a great day and be well.